We are entering the seasons where colds, viruses, allergies can get our kids sick. And the CDC's latest national positive tests show the number of positive RSV cases overall in the country detected here are slightly trending up since early September. But the levels are still nowhere near last winter, but we know that can change pretty fast. So with the new RSV shots in the mix, could that help this year? Akron Children's Hospital's Mahoning Valley's neonatologist, Dr. Justin Blind, is here now to go over all of the latest on this. Thank you so much for taking the time, Doctor.
Well, thank you very much for having me.
Yes, RSV really does fill up hospitals. In the winter, we see this across the country with babies that are struggling to breathe. Are you seeing or even anticipating numbers to go up as we get toward the cooler times of the year?
Yeah, RSV is cyclical, so it is not uncommon that we have a rise in ER visits, scared families and patients, and hospital admissions, unfortunately. So we expect that to happen again this year.
Okay. What are some of the symptoms and how do you tell this apart from the COVID, flu, cold, and pneumonia too?
It's a great question. I think at home, there's almost no way to tell. I think what happens is, what we see concerned families with babies that have fast or what we'll describe as labored or difficult breathing. Those are babies that need to seek medical attention, either at their primary care provider or at their local emergency room.
Got it. The U.S. Food and Drug Administration approved a new antibody in July. We talked about it here on the news a little bit. A shot, not a vaccine, though, is what this is. It's by Beyfortus. How much can this maybe cut the risk of illness from what you've learned about this new shot?
Yeah, so this new medication is a game changer. So you're exactly right. This has now been approved by the FDA. It's recommended by the CDC as well as the American Academy of Pediatrics. And this is a monoclonal antibody. So you're right, it's not a vaccine. It's so important that it is actually going to be part of the Vaccine for Children program, just because that infrastructure is set. So you may see it be called a vaccine for children or a medication. Either way, it's going to change what happens with RSV.
And what age group usually gets this shot here in the near future?
It's a great question because it's so new. The guidelines are still coming out. So right now it's recommended for patients under 8 months of age, even as young as babies that are just born. We will be administering it to the babies that are discharged from our NICU because they are at a much higher risk of long-term injury from RSV. And even patients with difficult medical situations can apply to get this medication up to the age of 2. So lots of our former NICU graduates will qualify to receive this medication.
All right, great to hear that we have the resource now. How dangerous is RSV in young kids, and how hard is it for someone like you to treat when you see the pictures of the babies in the hospital, especially last year? We saw that big wave. It is so sad to see. They are having such a hard time breathing.
They are. And what's interesting is we don't have medications to specifically treat RSV. So we have this monoclonal antibody that will prevent it. So what this monoclonal antibody will do will bind to the virus and prevent it from entering the cells. So it keeps us from getting the disease. What it won't do is treat babies once they have it. So once someone gets RSV, this won't help them. And so as physicians and nurses and our hospital practitioners, it's very difficult. That's why you see the pictures of babies with breathing support. And frequently they can't eat, so they need IV fluids. It's really supportive care that we can give. So this medication that's preventative is a total game changer.
And doctor, any quick tips for us parents just so we can keep our kids as healthy as possible? Because we know once they get sick, the whole house goes down with them.
Yeah, the number one thing is washing your hands. As old as silly as that sounds, it's the same thing that they were telling us for, when COVID happened, is washing your hands and good hand hygiene and not sharing of liquids and drinking materials as another key that'll decrease the likelihood of infection.
Thank you for joining us.